Alzheimer's and vascular dementia look identical at first glance, but one steals memories silently, the other strikes without warning. If doctors mistake one for the other, families can lose precious time, hope, and the chance to protect the brain before it's too late. Welcome to Wellness Unfolds, where we explore the complexities of the human brain to help you live a healthier, longer life. Dementia is not a single disease, but a term covering many conditions, with Alzheimer's and vascular dementia being the most common. Although they share similar symptoms, the underlying causes and progression of these two conditions are fundamentally different in many ways. Understanding the distinct differences between these two conditions is vital for accurate diagnosis and creating the most effective treatment plan. Misdiagnosis is alarmingly common because the symptoms often overlap, leading to ineffective treatments and unnecessary stress for families and patients. Today, we will dissect the 7 core differences that distinguish vascular dementia from Alzheimer's disease to bring you clarity. By the end of this video, you will have a comprehensive understanding of how to protect your brain and spot warning signs. Let us begin by examining the mechanism of formation, the fundamental biological processes that trigger these two distinct brain conditions. Vascular dementia is primarily caused by reduced blood flow to the brain, which deprives brain cells of vital oxygen and nutrients. This damage often results from a series of small strokes or chronic conditions that damage the complex network of blood vessels. When blood flow is interrupted, brain cells in that specific area die, leading to the loss of functions controlled by that region. In contrast, Alzheimer's disease is characterized by the abnormal accumulation of proteins, specifically beta-amyloid plaques and tau tangles within the brain. These toxic protein buildups disrupt communication between neurons and eventually cause massive cell death throughout the brain's memory centers. Think of vascular dementia as a plumbing problem, while Alzheimer's is more like a waste disposal failure within the brain cells. Both mechanisms lead to brain damage, but the pattern and location of the injury differ significantly between the two diseases. The first major difference lies in the progression pattern, or how the disease advances and worsens over a period of time. Alzheimer's disease typically follows a slow, gradual, and continuous decline, like walking down a gentle hill without any flat pauses. Families often cannot pinpoint the exact start of symptoms because the changes happen so slowly and subtly over many years. Vascular dementia, however, often progresses in a stepwise fashion, with periods of stability followed by sudden drops in ability. These sudden drops usually correspond to a new stroke or vascular event, causing immediate and noticeable loss of function. Patients with vascular dementia may experience good days and bad days, showing fluctuation that is less common in early Alzheimer's. This step-like progression is a key diagnostic clue for doctors when reviewing the patient's medical history and timeline of symptoms. The second critical difference is the nature of early symptoms, which depends on which part of the brain is affected first. In Alzheimer's disease, the hippocampus is usually the first area damaged, making short-term memory loss the most prominent early sign. Patients often repeat questions, misplace items constantly, and struggle to retain new information while their old memories remain intact. Vascular dementia typically affects executive function first, which includes planning, organizing, decision-making, and solving complex problems. Memory might still be relatively good, but the ability to process information quickly and focus attention is significantly impaired. While Alzheimer's erases the story of the past, vascular dementia breaks the control panel needed to navigate daily life. The third difference involves physical movement, specifically how the disease affects a person's ability to walk and maintain balance. In the early stages of Alzheimer's, physical movement is usually unaffected, and patients can often walk and move normally. Mobility issues in Alzheimer's patients typically do not appear until the later stages of the disease progression. Conversely, vascular dementia often presents with early physical symptoms, including a shuffling walk, unsteadiness, and frequent falls. Since vascular dementia is linked to strokes, patients may also show weakness or paralysis on one side of their body. This early onset of walking difficulties is a strong indicator that the damage is vascular rather than purely neurodegenerative. The fourth difference is visible only through advanced technology, specifically how the brain looks on MRI and CT scans. Brain scans of Alzheimer's patients typically show generalized shrinkage or atrophy, particularly in the temporal lobes where memory is stored. The brain tissue literally wastes away over time, leaving larger fluid-filled spaces and gaps within the brain structure. Vascular dementia scans reveal a different picture, often showing evidence of past strokes, bleeding, or white matter disease. These specific white spots indicate damage to the brain's communication cables caused by chronic poor blood flow over many years. Radiologists use these distinct visual patterns to help confirm the diagnosis and distinguish between the two types of dementia. The fifth difference highlights the risk factors, which are the underlying conditions that increase a person's chance of developing the disease. The primary risk factors for Alzheimer's disease are age and genetics, specifically the presence of the APOE4 gene variant. While lifestyle plays a role, the genetic component in Alzheimer's is significant and unfortunately cannot be changed by the patient. Vascular dementia risks are identical to heart disease risks, including high blood pressure, diabetes, high cholesterol, and smoking. These are largely modifiable risk factors, meaning they are directly related to lifestyle choices and management of chronic health conditions. There is a saying that what is bad for your heart is also bad for your brain, especially for vascular dementia. The sixth difference involves how these conditions respond to medical treatments and pharmaceutical interventions currently available in modern medicine. Drugs like cholinesterase inhibitors are FDA approved for Alzheimer's and can temporarily help manage memory symptoms and cognitive confusion. These medications work by boosting chemical messengers in the brain that are depleted by the progression of Alzheimer's disease. For vascular dementia, these same drugs have shown limited benefits and are not officially approved as a standard treatment. Instead, treatment for vascular dementia focuses aggressively on controlling blood pressure, diabetes, and cholesterol to prevent further brain damage. The seventh and perhaps most important difference is the potential for prevention, offering a ray of hope for many people. While we cannot yet fully prevent Alzheimer's due to its genetic roots, vascular dementia is considered highly preventable. By maintaining a healthy cardiovascular system throughout midlife, you can significantly reduce your risk of developing vascular cognitive impairment. Simple actions like quitting smoking, limiting alcohol, and staying active act as a powerful shield for your brain's blood vessels. These 7 differences highlight that while the destination of dementia is similar, the journeys and solutions are quite distinct. Now that we have outlined the core differences, let us dive deeper into the specific nuances of vascular dementia first. Vascular dementia is often called multi-infarct dementia, meaning it is caused by many small strokes accumulating over time. Silent strokes can happen without you knowing, often triggered by unmanaged high blood pressure during periods of extreme stress. Atherosclerosis, or hardening of the arteries, restricts blood supply to the brain's deep white matter, causing slow, progressive damage. This specific type of damage to the deep white matter is sometimes referred to as subcortical vascular dementia, or Binswanger's disease. Patients with this condition often display emotional lability, laughing or crying inappropriately due to the disruption of brain circuits. Physical symptoms like difficulty swallowing or slurred speech are much more common in vascular dementia than in early Alzheimer's. Neurological exams often reveal brisk reflexes or other signs of motor system damage that provide clues for the diagnosis. Turning our focus back to Alzheimer's, it is important to understand why memory is the first casualty of this disease. The hippocampus is the brain's save button, responsible for converting short-term experiences into long-term memories for future retrieval. Because Alzheimer's pathology attacks this region first, the ability to form new memories is destroyed before other functions fail. This is why a person might vividly recall their wedding day from 50 years ago, but forget what they ate for breakfast. As the disease spreads to other regions, symptoms evolve to include word-finding difficulties, spatial confusion, and personality changes. Getting lost in familiar places is a hallmark sign as the brain loses its internal map and spatial awareness capabilities. Confusion with time is also common. Patients may mix up day and night or believe they are living in the past. It is crucial to note that many patients suffer from mixed dementia, having both Alzheimer's plaques and vascular damage simultaneously. Autopsy studies show that mixed dementia is actually very common, especially in people over the age of 85. When both conditions are present, the decline in cognitive function is often faster and more severe than with either alone. Interestingly, managing vascular risk factors can also help slow down the progression of symptoms in patients with Alzheimer's disease. Good blood flow helps clear toxins from the brain, potentially helping to wash away some of the harmful amyloid proteins. This brings us to the MIND diet, a nutritional strategy designed specifically to protect the brain from both vascular and neurodegenerative damage. The diet emphasizes green leafy vegetables, berries, nuts, and whole grains, which are proven to support brain vessel health. It also strictly limits the intake of red meats, butter, cheese, and sweets, which can clog arteries and inflame the brain. Physical exercise is another non-negotiable pillar, as it directly stimulates the growth of new blood vessels in the brain. Exercise releases a protein called BDNF, which acts like a fertilizer for brain cells, promoting their survival and growth. Quality sleep is equally critical because the brain's cleaning system, the glymphatic system, is most active while we are sleeping. Treating sleep apnea is vital, as oxygen deprivation during sleep can accelerate both vascular damage and Alzheimer's pathology. Social isolation is a major risk factor. Staying socially active keeps the brain stimulated and builds cognitive reserve. Challenging your brain by learning new skills, like a language or instrument, strengthens neural connections and builds resilience. Chronic stress releases cortisol, a hormone that can literally shrink the memory centers of the brain over time. For caregivers, knowing the difference between these types of dementia helps in predicting needs and managing daily expectations. Caregivers of vascular dementia patients need to be prepared for sudden mood swings and assist more with physical mobility. Caregivers of Alzheimer's patients require immense patience for repetitive questions and need strategies to manage wandering behaviors. Early diagnosis allows for better planning, access to clinical trials, and implementation of lifestyle changes that can slow progression. If you notice sudden confusion, difficulty speaking, or trouble walking, seek medical attention immediately, as it could be a stroke. There are many success stories of people who stabilize their vascular dementia simply by aggressively managing their heart health. The brain has an amazing ability called neuroplasticity, meaning it can form new connections to bypass damaged areas. Research is advancing rapidly, with new drugs targeting amyloid removal and therapies designed to repair damaged blood vessels. Remember, vascular dementia is a supply problem, while Alzheimer's is a structural degeneration problem, though both end in cognitive loss. The best time to start protecting your brain is today, regardless of your age or current health status. Treat your heart like a treasure, for it is the engine that keeps your mind sharp and your memories alive. Preserving your cognitive health is the greatest gift you can give to yourself and to the loved ones who cherish you. Let's look closer at high blood pressure. The continuous force damages the delicate inner lining of the brain's smallest vessels. Diabetes is another major villain. High blood sugar acts like a slow poison to the blood vessels and nerves. High cholesterol leads to plaque deposits that can break off and travel to the brain, causing sudden blockages. Atrial fibrillation, an irregular heartbeat, allows blood clots to form in the heart and travel directly to the brain. Smoking introduces chemicals that instantly constrict blood vessels and reduce the amount of oxygen reaching your brain cells. Excessive alcohol consumption is directly toxic to neurons and can lead to a specific type of alcohol-related dementia. Deficiencies in vitamin B12 can mimic dementia symptoms, and high homocysteine levels can damage arteries, increasing vascular risk. Depression is common in both, but vascular dementia patients are often more aware of their deficits, leading to deeper sadness. Hallucinations and delusions are more characteristic of middle-stage Alzheimer's or Lewy body dementia than pure vascular dementia. Urinary incontinence often appears early in vascular dementia due to nerve damage, whereas in Alzheimer's, it is a late symptom. Sleep patterns are disrupted in both, but vascular patients may sleep excessively due to brain fatigue from stroke damage. Swallowing difficulties can lead to pneumonia, which is a leading cause of severe complications in vascular dementia patients. Rehabilitation therapies, including physical, occupational, and speech therapy, can help vascular patients regain some lost functions. For Alzheimer's, the focus is less on rehabilitation and more on adapting the environment to ensure safety and comfort. Music therapy is incredibly effective for both, as musical memory is often stored in a different part of the brain. Interacting with gentle animals can reduce anxiety and lower blood pressure, providing nonverbal emotional support for patients. Modern technology like GPS trackers and smart home sensors allows patients to maintain independence longer while staying safe. For those who have already had a stroke, Secondary prevention is key to stopping the stepwise decline of vascular dementia. Staying hydrated is simple but crucial, as dehydration can thicken the blood and increase the risk of clot formation. Correcting hearing and vision loss is essential, as sensory deprivation can mimic or worsen the symptoms of dementia. Loneliness is toxic to the brain. Ensure your loved ones have regular companionship to keep their minds active and engaged. Discussing legal and financial plans early on ensures that the patient's wishes are respected when they can no longer decide. Palliative care focuses on quality of life, managing symptoms, and providing comfort rather than invasive treatments in later stages. Life expectancy varies greatly, but vascular dementia can sometimes have a shorter prognosis due to the risk of fatal heart attacks. While rare, there are specific genetic forms of vascular dementia like CADASIL that can affect younger people in families. Women are disproportionately affected by Alzheimer's, likely due to hormonal changes at menopause and longer average lifespans. Men historically have higher rates of vascular dementia, often correlating with higher rates of heart disease and stroke. Emerging research shows that long-term exposure to air pollution increases the risk of both vascular problems and neurodegeneration. Protecting your head from injury is vital, as past concussions can increase the vulnerability of the brain to dementia. Surprisingly, gum disease is linked to heart health and inflammation, so oral hygiene is part of brain protection. The biggest takeaway is that the brain does not exist in isolation. It is connected to every other system. Do not skip your annual physical exams. Knowing your numbers for blood pressure and cholesterol is the first step. Share this information with your loved ones, as awareness is the most powerful tool we have in this fight. You are not alone in this journey. There are support groups and resources available to help you navigate these challenges. Human resilience is remarkable, and with the right knowledge and care, we can maintain quality of life despite diagnoses. To recap vascular dementia, remember the keywords stroke, stepwise decline, and prevention through heart health management. For Alzheimer's disease, remember memory loss first, gradual decline, and protein accumulation as the defining features. Knowledge is power. Understanding these distinctions empowers you to advocate for the best care for yourself and your family. We invite you to reflect. What is one healthy habit you can start today to invest in your future brain? Maybe it is a 30-minute daily walk, adding more vegetables to your dinner, or finally quitting that smoking habit. Perhaps it is challenging your mind with a puzzle, or reaching out to an old friend to reconnect socially. Remember that it is never too late to start making positive changes that will benefit your brain and body. Science is working tirelessly to find cures, but until then, prevention remains our most effective and accessible strategy. Be wary of miracle cures and unproven supplements. Always consult your doctor before adding anything new to your regimen. Keeping a health journal to track symptoms and changes can be an invaluable tool for your doctor during appointments. Your genes are not your destiny. Your daily choices have the power to influence how your genes are expressed. Thank you for spending your valuable time with us to learn about these critical aspects of human health. At Wellness Unfolds, our mission is to decode medical complexities so you can live a life of wellness and clarity. If you found this video helpful, please subscribe and hit the notification bell to stay updated with our latest content. We recommend watching our other videos on stroke prevention and the best diets for brain health to learn more. We wish you and your loved ones a future filled with health, happiness, and sharp memories for years to come. Thank you for watching Wellness Unfolds. Take care of your brain, and we will see you in the next video.